Good day everyone, my name is Chris Daniel M. Sumawang and I'm a student nurse from Tarlac State University from BSN 2B. And for today, I will be performing a performance evaluation checklist about the administration of an enema. So first thing that we need to know is the purpose of our performance. So first, it is a technique used to stimulate stool evacuation. Second, it is a treatment used to relieve severe constipation. And lastly, it is the management used to cleaning the carminative, retention, and return flows. And after that, we will now proceed to our assessment phase. We need to assess our patient for the following. First is the last bowel movement, the amount, the color, as well as the consistency of the stool. And also, we will be assessing whether the client has a abdominal distension, and we will be assessing our client if he or she has a sphincter control, and lastly, if our client has the ability to use the toilet, the commode, or the bedpan in bed. Okay? So, good day po ma'am. My name is Chris Daniel Sumawang and I am a student nurse po from Tarlac State University. And ask ko lang po, mag-ask lang po ako some series of questions like, kailan po ba yung ating huli pong last na nag-defecate? Okay po. So, bakit po sa nakita nyo, wala naman po ba tayong, ano po yung color po ng ating feces? Okay. So, ask ko lang po sana kung madami po ba o kakaunti lang po. Okay. So, based po sa nakita nyo, ano po ang characteristic po ng ating pong stool? Kung basa po ba siya, o matigas, o soft? Okay po. So, as I can see naman po, wala naman po tayong abdominal distension. And also po, ask ko lang if wala lang po ba kayong nararamdaman na pagtagas po sa ating pong buttocks? Okay po. And last question po is, kaya po ba nating pumunta sa CR mag-isa? Mag-defecate mag-isa? Okay. So, ask ko lang po kung saan niyo po gusto mag-defecate, or kaya niyo po ba sa ating pong CR, or gusto niyo po ba sa commode or sa bedpan? Okay po. And for our next step, we need to, for our planning phase, we need to check again our client if he or she has a past history or presence of kidney or cardiac disease, as this could contraindicate to the use of the enema. Also, we will be checking the physician's order for the need of the administration of enema. So, okay po. So, ask ko lang po sana if meron po kayong present or past history po ng kidney or cardiac diseases po. Okay, so wala naman po, mabuti. So, for our next step, which is we need to assemble our equipment, we do need to have, first is for example, this is a disposable linen saver pad. Next is our bath blanket. Also, we do need to have, for example, this is a bedpan or a commode, but for this instance, we don't have a commode. Okay. Also, we do need to have some clean gloves, a water-soluble lubricant, for example, and also we do need to have a paper towel. So for example, this is a paper towel. Okay. And lastly, for our next material or our next equipment, we do need to have an enema solution. So for our implementation phase, so first thing that we need to do for our preparation, we need to lubricate our rectal tube for about 5 centimeters or about 2 inches. Okay. Okay, so for example, this is our water-soluble lubricant. Okay, we're about 2 inches. We need to put it. Okay, and we need to remember not to touch the lubricated part of our tube. And after that, we will need to run the solution to the connecting tube of the uh, large volume of enema set as well as the rectal tube. And we will need to expel some air to the tube, and after that we will be closing the clamp. Okay. So for example, we have run the solution. Okay. Okay, so we have already removed the bubbles onto the tube. Okay, we will now be clamping it. Okay, and we will be placing it to the disposable towel. And after that, prior to the prior to doing the procedure, we will now proceed to our introduction. So we need to introduce ourselves to our patient, and we need to verify the patient's identity. Okay. So good day po ma'am. As I said earlier, my name is Christine Mawang, and I am a student nurse from Tarlac State University from BSN 2B. So I will be your nurse for today po. Okay po? Okay, so may I ask for your name po? Okay, how about your birthday po ma'am? Okay, so may I see your wristband po? Okay. Thank you po. And after that, we will need to explain the procedure to our patient, and we need to explain what we are going to do, why is it necessary, and how the client can cooperate. Also, we will need to indicate to our client that he or she may experience the feeling of being full as we administer the enema solution. Okay, so as I said earlier po, today po we will be administering ang enema solution po sa inyo po. Is that okay? Okay, so what we are going to do po is mag-a-ask lang po sana ng consent because I will be touching po some various areas po sa inyo pong buttocks, and I will be touching it po specifically with my fingers. Okay lang po? Okay, so this is very necessary po to because it is a treatment po for severe constipation, as well it is a technique po used to stimulate po a stool evacuation, and also this is a measurement po that is used for a management use po to clean the carminative retention and the return flow of our procedure. Okay po? Okay, so also po, let me remind you lang po that upon administering po yung ating pong enema, you may feel a little full po sa ating pong sa part po na ating ina-assess. Okay lang po? Okay po. This may feel po a little uncomfortable po, but please bear with us po. Okay po? So will you cooperate with me po? Okay, thank you po. So for our next step, now that we got the patient's consent, we will now proceed to our next step, which is we need to perform hand hygiene, and we need to observe other infection control procedures. Okay? So for example, that I have upon entering the patient's room, I have already washed my hand. Now I will be just doing is spraying my hands with an alcohol solution. Okay? Until the alcohol dries. Okay, now that for our next step, we will be putting on our clean gloves. Okay. And for our next step, we need to provide some privacy for our patient by closing the curtains around the bed and closing the doors to the room if possible. And if our patient's bed is near the windows, we need to close the windows as well to provide some privacy, okay? So for our next step, we will need to uh, place or position our client to a left lateral position with his or her feet or legs flexed, acutely flexed as much as possible. And after that, we will be putting the linen saver, a pad under the patient's buttocks. So to do that, first we will need to cover the patient with a bath blanket and we will be removing the top sheet, okay? So ma'am, tatanggalin ko na po yung top sheet. Okay lang po. Okay. And after that, we'll now be repositioning our patient. Okay, so ma'am, i-move ko lang po kayo, ituturn ko po kayo dito sa side na to. You can hold po the side rails po para hindi po tayo malaglag sa other side. Okay po? 1, 2, 3. Okay. After that, we will now be putting the disposable linen saver pad under the patient's buttocks. And after that, we will need to insert now the enema tube to the client's rectum. And for the client that is on the left lateral position, we will need to lift the buttocks or separate the buttocks so we can see the patient's anus. Okay, so let's first reassure our patient that we will now begin with our procedure. Okay. So ma'am, we will now begin our procedure po. May I expose na po yung ating pong area, which is your buttocks po natin. Okay. Okay, now that we got the tube, so let me remind you that this tube is still in clamped or closed. We will be inserting the tube now. Okay, so we will be inserting it slowly and smoothly to the patient's rectum. And to do that, we will need to insert it for about 7 to 10 centimeters. Okay, so if we experience any restrictions or any difficulty upon inserting, we will need to ask our client to take a deep breath if we can access the internal sphincter, and we will be running again a small amount of solution. Okay, so ma'am, ipapasok ko na po yung ating pong rectal or ating pong enema tube. Okay po, so ready po in 3, 2, 1. Okay. Also, we need to remember never to force the tube nor the solution to enter the patient. And also, we need to, if instilling persists or does not permit, we will need to withdraw the tube freely and we will do the procedure again. And also, we will be checking the tube for any blockage of feces. So if there is a presence of a blockage to our tube, we will need to flush it and we will redo our procedure. Okay, so for example, we have not encountered any blockage. Our next step is to insert it again. And again, if we experience any persist, uh, if the patient resists, uh, experience resistance, we will need to end our procedure and we will need to report it to the primary healthcare provider. Okay, so now we will be administering the solution. And to do that, we will need to raise the solution container and we will need to open the clamp to allow fluid flow. Or if we are using the enema bottle, we will need to compress a pliable container by our hand. And we need to remember that if we are administering a low enema, we need to hang or hold the solution container for about 30 centimeters away or 12 inches away from the rectum. And if we're doing a high enema, we will need to hang or hold the solution container for about 45 centimeters or about 18 inches away from the rectum. Okay, so now we will need to administer the solution slowly. So if our client reports pain or the experience of fullness, we will need to lower the solution container or to close the clamp for 30 seconds and we will restart the flow at a much slower rate. Okay, so for example, if we are using an enema bottle or a plastic commercial enema, we will need to roll it as we instill the solution. And so for example, after we have instilled the solution to the patient's rectum or the patient's buttocks, and the patient feels the urge to defecate, we will need to close the clamp again. So for example, we have closed the clamp or the tube. We will now withdraw the tube using our hands. So gently pull the tube, okay. And after that, we will need to place the tube to the disposable paper. Okay. As we withdraw it, okay. And for our next step, we will need to cover again our patient, and we will be instructing our patient to retain the enema, and also we will be requesting our client to remain in her position, which is lying back, and we will be requesting our client to hold the enema for a appropriate amount of time. And so for example, if we administered an cleansing enema, the patient should retain it for about 5 to 10 minutes. And if we administered a retention enema, the patient should retain it for about 30 minutes. So for example, we have administered the retention enema. So for example, the 30 minutes had already passed. For our next step, we will be assisting our client for the defecation if the patient urges to defecate. And to do that, we will be assisting our client to the sitting position on the toilet, commode, or the bedpan. Okay. So for example, our client wishes to defecate onto the bedpan. Okay, so first we will need to position our client to the bed to a comfortable position. So okay, ma'am, that is a position. Still covering the patient. Now we will be inserting our bedpan under the patient's buttocks. Okay. And now we wait for the patient for the defecation. So And for our next step, after assisting our client, we will now observe. Uh, After the client defecated, we will now observe the feces on the toilet, the bedpan, or the commode. And if the doctor wishes a specimen or if the specimen is required, we will need to instruct our client or our patient to use the commode or the bedpan. Okay? Now that we are done with our procedure, we will now remove our gloves and we will be performing hand hygiene again. So there are other variations of administering a return flow enema. Okay, so for our procedure, we will need to, for a return flow enema, the solution that we're going to use is about 100 to 200 ml for adults is instilled into the client's rectum and sigmoid colon. And then the solution container is lowered so that the fluid flows back out through the rectal tube into the container, pulling the flatus with it. And also the inflow and outflow process is repeated for about 5 to 6 times, and the solution is replaced several times during the procedure if it becomes thick with feces. And now we will now proceed to our evaluation phase. So first thing that we need to do is we need to document the procedure, the type and volume if appropriate for the enema given, also the type of solution, the length of time the solution was retained by the patient, and the amount, the color, and the consistency of the returns, and the relief of the flatus and abdominal distension into our client's record. And for our final step, we need to observe our client for any possible reactions to the administered enema given. Okay, so that would be all for the assessment or the performance of the administration of enema. Again, my name is Chris Daniel M. Sumawang and I am a student nurse from Tarlac State University from BSN 2B. Thank you.